Good afternoon, guys. This discussion A today deals with seniors living without family are missing many of the care options that could dramatically improve their quality of life. So that's what we're discussing for A. So please join me for discussion A today. Here we go. Yes, seniors living without family are missing many of the care options that could dramatically improve their quality of life. The research is remarkably consistent. Older adults who live alone or have no close family face more unmet needs, poorer health outcomes, and less access to the very supports that keep people safe, independent, and connected. What's missing and why it matters. Unmet daily living needs are common. Older adults living alone are significantly more likely to go without essential help, such as getting out of bed, grocery shopping, cooking, paying bills, due to lack of available assistance. These are not small gaps. They are directly affecting, they directly affect safety, nutrition, mobility, and the ability to remain at home. Higher risk of poor health outcomes. A major scoping review found that older adults without care partners experience adverse health and well-being outcomes. Including physical, psychological, and social challenges. Cambridge University Press and Assessment. This includes higher risk of hospitalization, functional decline, and isolation. They often don't know who will care for them. Many solo agers, people without spouses or children, report having no one they can count on for basic tasks like cleaning, cooking, or managing care. Only a quarter have someone they can or have someone they could rely on for household help. For they rely more on unpaid uh, they rely more on paid care even with lower incomes. Adults aging solo are more likely to use paid caregivers despite having fewer financial resources than peers with family support. This this accelerates financial strain and can push people into crisis sooner. The care options they're missing: community-based programs, Evidence shows that interventions focused on nutrition, social participation, and combined supports significantly improve health behaviors and mental health for older adults living alone. But many seniors don't know these programs exist or can't access them without help. Local senior center support. Senior centers often provide check ins, transportation, meals, and social connection. But solo seniors may not be plugged into these networks. Care coordination. Without families, older adults often lack someone to navigate medical appointments, insurance, medications, and home care services, a role that dramatically affects outcomes. Informal network supports. Give me 1 second, folks. Be right with you. Research shows solo agers depend heavily on siblings, friends, neighbors, and paid aides. But these networks are inconsistent and often insufficient. Bottom line, older adults without family aren't just missing companionship, they are missing the infrastructure of care that most aging in place systems assume will be provided by relatives. The result is more unmet needs, higher health risks, greater financial strain, less ability to remain independent. Lower quality of life, and yet the right supports do exist. They're just not reaching the people who need them most. Community based interventions do work for older adults living alone, and the evidence is strong across multiple systematic reviews and meta analysis. These programs consistently improve health behaviors, mental health, independence, and the ability to remain at home. Below is a clear, evidence grounded synthesis of what research shows. Key takeaway: community based interventions, especially nutrition programs, combined multi component programs, and holistic care planning models, significantly improve outcomes for older adults living alone, with some producing large effects sizes on health behavior and mental health. What the 2024 systematic review and meta-analysis found: effectiveness of community-based interventions for older adults living alone. Epidemical Health 2024 synthesized 9 studies for RCTs, 5 non-RCTs, and categorized interventions into physical activity, nutrition, social relationship, social participation, and combined programs. Most effective interventions: nutrition programs, effect size 0.96, 95%, CI 0.66, -1.25, large impact. Combine multiple component programs, effect size 0.43, which works out to be 95%, CI 0.26, -0.60. Outcomes with greatest improvement: health behavior, effect size 0.98, 95%, CI 0.73, -1.22. Mental health, effect size 0.67, which is 95%, CI 0.19, -1.6. Why it matters. These interventions directly address the vulnerabilities of older adults living alone. Nutrition risks: isolation, inactivity, and lack of structured support. Evidence from broader reviews of community-based complex interventions. Even though these reviews include older adults living at home more broadly, not only those living alone, their findings reinforce the same pattern: multi-component coordination care works. Network meta-analysis: 129 studies, interventions with multifactorial individualized care planning, including medication review and follow-ups, improved the likelihood of living at home. Odds ratio 1.22, 95%, CI 0.93, -1.59. Okay, increased likelihood of living at home, RR 1.05, 95%, CI 1.00, 0.10. Improve cognitive function and instrumental ADLs. Frailty satisfied network. Meta-analysis. NIHR 2024. Again, multifactorial interventions, assessments, care planning, medication reviews were the most effective for sustaining independence. What this means for older adults living alone. Across all reviews, a consistent pattern emerges. Most effective components: holistic assessment, individualized care planning, nutrition support, exercise plus ADL training, medication review, regular follow ups, social participation programs, most improved outcomes, health behaviors, and mental health. Okay, guys, that's your A for today. I will see if I can do another show in a few minutes. For now, Gator Wellness, take care, folks.